A family that's struggling with a life-limiting illness like motor neuron disease, they need the skills of their community, the lived experience of people who have been there to help them through the journey. They need their friendship, they need love and laughter throughout the way to relieve that pressure that's unrelenting that people live under. So motor neuron disease is a neurodegenerative condition, and the neurons die, and therefore when the neurons die, all the muscles basically die. So a person with motor neuron disease can't use their muscles for anything, not even smile. Palliative care is a wonderful, wonderful field. It's not about clinical care only. It's about psychosocial, spiritual, existential support, bereavement support, family care support. And of course, this is what motor neuron disease patients needed and their families, because there's very little you could do for them clinically. You know, there's no treatment, there's no cure. And I felt all that was missing from them. They're left to their own family support. People who are dying only spend 5% of their time with a doctor, with a nurse, with allied health professional. So where do they spend the rest of their time? 95% of their time, they spend it with their spouse, family, friends, neighbors, and unfortunately some alone. And this is where, you know, social connectedness, it's vital in these cases. My vision and hope is that every person, every family, and every community knows what to do when someone is looking after somebody who has got a terminal illness, is dying from a terminal illness, or grieving from it. Because this is everyone's responsibility. It's not just the health services, and it's everyone's business to know what to do, how to help each other, to have better health care, better quality of life, and better quality of death eventually. This led me to basically broaden my horizon to all life-limiting illnesses, because this is what we have in the community. And it needs to be inclusive, it needs to be not selective, and again, we're looking at the suffering that's happening regardless of what diagnosis people have. So what we need is not only kind communities, we need compassionate communities, well-equipped in terms of their death literacy and grief literacy.